Hi, I'm Vaseem Khatri. I'm a PGY5 radiation oncology resident at Moffitt Cancer Center. Here at ASTRO 2025, presenting a project on outcomes of melanoma brain metastases with nivolumab and relatlimab after progressing on ipilimumab and nivolumab or ipi/nivo. So, a little bit of background: relatlimab is a lymphocyte antigen 3 inhibitor that is given in combination with nivolumab in fixed doses, a combination called Opdualag for metastatic melanoma. And some trials have demonstrated intracranial efficacy of nivolumab and relatlimab for melanoma brain metastases, but we have limited information on the actual outcomes and how patients fare when they're given that combination. So we looked at our patients treated at Moffitt who had received the combination Opdualag from 2022 to 2024. All those patients had melanoma brain metastases and had received prior ipi/nivo. And we excluded patients who had prior leptomeningeal disease. So it was the Kaplan-Meier method for time to event outcomes like overall survival, local control, and intracranial failure. And we collected data on adverse events and symptomatic radiation necrosis. So we ultimately identified 24 patients, the majority of whom were male. The majority did receive local therapy of SRS or surgery with Opdualag. Median follow-up was 28 months. About a third had neurologic symptoms. A quarter were NRAS mutant, and a third were BRAF V600E mutant. Ultimately, 75 lesions were treated with local therapy. The majority of those, 96%, were treated with SRS or FSRT, and 4% had surgery only and did not have post-op SRS or FSRT. We identified 24 courses with a median dose of 24 gray in 1 fraction, and 63% of these 72 lesions were treated concurrently with NIVO-RELA and SRS. So here's our Kaplan-Meier curve for overall survival, going out to 24 months, for intracranial progression-free survival, and local control. And so the actual numbers, so our median overall survival was 12 months, with a 55% 12-month overall survival rate. Death was associated with a younger age, at younger than or equal to 72 compared to over 72. And with the presence of neurologic symptoms, and both of those were significant on multivariate analysis. Our intracranial progression-free survival median was 5.3 months with a 12-month rate of 38%. Our median extracranial progression-free survival, or systemic progression-free survival, was 2.8 months with a 12-month rate of 35%. And our 12-month local control was excellent at 94%. No lesion developed radiation necrosis, so sequential versus concurrent treatment, there was no difference because there were no events. And so our conclusion is that the combination of Opdualag appears efficacious after ipi/nivo for melanoma brain mets, which is an important thing to know because a lot of these patients are going to start off on ipi/nivo. It's indicated per the guidelines for melanoma brain metastases first line, and it has about a 60% intracranial objective response rate. NIVO-RELA, however, has about a 10 to 15% response rate on existing trials, and so there's still a role for local therapy in providing intracranial control, and we suggest that it is safe to do so concurrently while these patients are on that systemic combination.